You're up, Commissioner.
All right, we'll go ahead and open up this meeting. I don't see changes to our agendas.
Mr. Chairman, I would make a motion that we approve the agenda as posted.
We have a motion. All in favor, say aye.
Aye.
First item is Commissioner's Report, invoices. I just had my questions, and I know we've talked about it before, but it's just the fund that they label that
Oh.
it comes out of.
So revolving fund, yeah, that's essentially the sheriff's petty cash. And then what happens is there's certain items that they have to expend money, cash, right away to get paid. And then we just reimburse it and code it to the appropriate department, or appropriate line item. So basically, it's just petty cash. We've just always called it revolving fund.
And that's, I knew we'd talked about it, but when
Yeah.
I looked down there and there's 4 of them
Yep.
out of that.
And most of the time, it's just gonna be minor, little stuff, but once in a while, they'll have somebody that has to do a prisoner transport, and they need the per diem of cash and stuff like that, because
And how much do they keep in that fund?
I would need to double check.
But
But we check it on a regular basis, just like we do the other petty caches.
But they spend it and then we reimburse
Yeah.
them back into that same account.
Yes, we
So-
replenish it. So they always have the cash to roll.
Revolving it.
Yeah,
And then when they bring in the receipts, do you recode it to that?
yeah, that's
Okay.
exactly what we do. As they get the expenditure, or they bring in the reimbursement, we just pay it as if it was a check that we cut out directly.
And then this one just seemed to end abruptly. There's no totals, there's no.
Look at it. I wonder if, let me look at the electronic version. Oh, I didn't bring my iPad. It doesn't-
There's usually the other pages on behind
That
it.
shows-
You know what I'm saying?
Yep. Yep. Hey, Luann, it's Christy. Hey, on the commission report, there is no total page that shows the total, or it didn't get printed. Maybe their printer ran out of paper. How many pages is your commission report? Because this one ends on 17. Or maybe our printer, I guess we print it and take it down.
And the electronic copy that come with it was exactly the
The
same.
electronic copy looks the exact same way, so. Oh, well, that's weird. Okay. Will you print me just page 17 that shows the total? Okay, cool, thanks. Bye. Okay, it just is 17 pages, so that's everything. It just, for some reason, so she's gonna bring up a new total page for you.
Okay, yeah,
So you
like I
can
said,
see
I
it.
got to the end of that.
Yeah.
Am I missing something or what? Because this isn't the norm that I usually have.
And of all
Okay.
the times I didn't bring my iPad to double check it, but
Okay, other than that, I didn't see any concerns of what was there, so. And then on top of that, this is the
Payroll.
payroll. Is that under a different one, different heading? Still there.
yeah, that's not listed in the agenda, but you could probably include it as commission report. 'Cause
Commission
it's
report,
essentially,
would I?
it's just payment of all payroll and stuff.
There's some invoices.
And then I do have one credit app
Okay.
to talk about.
Do you want to sign that one? It's right there. Yep. Is that it?
Yep.
Okay, Mr. Chair, make a motion.
Unless, did you have an invoice that you want?
No, I just have a credit app.
Oh, credit application, okay.
Mr.
Well, it's
Chair, make
under
a
the same line.
motion that we approve the invoices, commissioners' reports as presented.
Your motion, all in favor, say aye.
Aye.
All right, credit application.
I have a credit application, it's all going to be done online, it's for Cisco, it's for the event center so that they can buy food-related items after the Orion contract ends. Legal has reviewed it. Alan's only concern was within the paper copy that we had, which they don't usually give paper copies, it said something about an out-of-state litigation. So what I was going to do with commission approval is do the online application, and if it has any reference anywhere for an out-of-state litigation, I would just either not continue or see if there's somehow I can line through it. This is as good as I can do. This is page 1 of the application, but it wouldn't let me print the other page without entering all of this information. I wanted to get commission approval before I even started the application process.
I think, yeah, I think we move forward on it, just simply, we need
You're gonna need
to,
it.
we need to change from Orion to something else
Yeah.
that is more palatable.
Yeah, and then if you see some question, we'll grab legal and see what they say.
Yeah, I can do that.
Okay,
So if you could authorize me to submit
let's
that.
go ahead for a motion.
All right, Mr. Chair, I make a motion that we authorize the auditor, Christy Clauser, to complete the online application for Cisco.
We have a motion, all in favor, say aye.
Aye.
Next, we have salary rate approval forms. And I have some problems.
Okay.
One is the assessor didn't tell us what was going on. She's chose her chief deputy.
She was, because there was in-house people that were applying, she was very close to the cup on, I found out when I saw the site approval form too.
Well, I talked to her. She says, well, I'll tell you when I make my decision. And I'm going through the salary rate approval.
Yeah.
Well, what's this one?
Yeah.
So last night I cussed her.
Yeah, that was how she, I think, handled everybody knowing it.
So, but I really don't have a problem with it. That's a good choice.
There's your final page if you want to confirm that number with the amount on the claim that you signed,
Okay.
all right? You want to have it bring up all in one?
Well, this is wrong. Look at the total.
Well, I don't know what that total
Well,
is.
just look at the total.
Oh, yeah, there's no way 512 is right.
$12,000 is, or
512 when we've got 100, okay. You know what, how about, do you want to, let me give her a minute to get downstairs, I'll have her print a whole one.
yeah. I mean, that one's definitely not our total.
And this doesn't even give me a date at the top to compare it with, so.
Anyway,
Okay, we'll get a whole new one in.
all right. This one. Hello, how are you, Maggie? These two I didn't have any problem with. Brown Bigelow. Equity. Don't have a problem with that one. But these two right here are from Public Defense. And this one says that we changed the caseload equivalent to senior deputy public defender. They didn't come talk to us about any of that.
Well, most of the time when they have a entry level and a senior level attorney position, if they do a move up from, okay, entry level does what caseload? I always get
I'm not sure on the public
It'd be
defender
the same as
side,
you
but
guys.
it's usually misdemeanors and
They do the same as you.
juvenile.
Okay.
And they, yeah, I think, I know the prosecutor's side, I just don't know the public defense side.
And I know they follow suit with how the prosecutors do it. So I just can never remember if misdemeanors is higher than felonies. I don't know anything about the court system, thank goodness.
Well, just the description on this, we changed the caseload.
Well, and that, so basically she was moved to a different caseload. She's picking up the felonies instead of the misdemeanors. If you want them to come before you,
That's,
then.
and I talked to Ryan yesterday, and he isn't here now. He was gonna call and talk to him about it. I just do not like the description.
Okay.
We changed the caseload. Did they change the job description? That's,
And essentially, yes, that's what happened.
that's, I don't like the way this one's
Sometimes
stated.
People's verbiage on salary approval forms could be more consistent.
And then this one just says exceptional placement with no
I need to look and see who that is.
data with it at all either. And I went and talked to Ryan, like I said, I went and talked to him.
Oh, this is a, dang it, I have got to start bringing all my stuff. That's what happens when I don't. I think what happened, she is from, they hired her from Twin Falls County, and they're wanting to hire her at a higher level than minimum.
Then they need to come talk to us, not just, that's all I'm saying.
Well,
The way these two come across, and I went and talked to HR, and Ryan says, maybe Josh knows more about it, but nothing's come before us yet for an exceptional placement or anything, so that's why
no,
I wasn't gonna sign these
what are
two
the start
today.
dates?
Official start date,
Blank,
posted start date,
April
Yeah.
1st,
Okay,
April
April
3rd.
3rd
Okay.
and April 3rd.
okay, perfect, so we've got time.
So,
Do you want me to take those and then call Janelle and tell them they need to get on the agenda for Tuesday?
yeah, and talk to Ryan, because Ryan was gonna call him yesterday,
Okay.
and that's what I said, I don't know for sure.
Okay.
Go ahead and give him
This
to
is just
her.
want to remember since I don't have my.
But I just didn't, I didn't like the verbiage on them. It just seemed like we're just giving somebody something because,
And I'll try to monitor the verbiage a little bit better and try to create consistency in what they're saying.
well, we just had that discussion with them, and nothing's come back to us since we had that discussion.
They are working on that. Janelle got a hold of me yesterday.
Okay,
Yesterday or Tuesday, I can't remember which day. So they are working on that further.
yeah.
I think Dave was gone for a couple of weeks.
He was, and that's what I understood, but that's when I got these, after that discussion, with no verbiage and nothing going on it,
Right.
I didn't like it.
Perfect, that works.
All right. Salary rate approval forms?
Mr. Chair, I make a motion that we approve the salary rate approval forms as presented.
We have a motion, all in favor, say aye.
Aye.
And next we have alcohol license, Family Dollar.
Okay, that's right, okay, thanks. Never mind. Bye. She says that's correct. What's your commission report say?
Retail.
Everybody that can.
We spent more than $12,000.
Yeah, she says that's what it says. There was just lots of little stuff and then a couple big ones. So yeah,
It's $12,000?
512. There's a 5 in front of you.
Okay.
Was that the,
That's,
There is a 5. It is
maybe I,
confirmed.
okay. I missed it. That's what I looked at and I see $12,000. Now, we spent more than $12,000. I can tell you.
Maybe you should get your glasses checked, Commissioner.
I need to. I've been trying to get an appointment. These are so scratched up. Anyway. All right. Did we do the alcohol? Okay, need a motion on the alcohol
Oh,
license.
Mr. Chair, I make a motion that we approve the alcohol license as presented.
We have a motion. All in favor, say aye.
Aye.
Aye. All right. Maggie, go ahead and come on up, if you would, please. Thank you for coming.
Thanks for having me. So I have to apologize. I am on call this week, and we every week on Thursday morning between 9 and 9:45 get a test call. So I will have to answer that, so I do apologize. Okay, so I have not met you. I'm Maggie Mann. I'm
John
the
Crowder.
District Director for Southeastern Idaho Public Health. So I wanted to just touch base with you all, number one. So prior to COVID-19, I used to meet regularly with county commissioners in all of our counties just to provide updates, share information, answer questions, but COVID sort of derailed all of that. So I would like to get back into some type of regular schedule to meet with you all. And I would like to hear from you what would be meaningful for you to hear from me about. Met with Bingham County yesterday. They shared what they are interested in hearing about. But I would like to know from you, what are some of the things that would be helpful for you? Would you like me to bring program staff and have them explain the work that they're doing in the county? Would you like me to provide communicable disease updates or kind of any hot topic kind of issues? I really would like to hear from you what would be meaningful for you.
I think one of the key things that we need to talk about is sewer systems and water.
Okay,
Where the health department has responsibilities there that people assume that the commissioners have responsibility for. And I think that would be a good communication and understanding roles and responsibilities
Okay.
in those fields.
Yeah.
okay. Now, I know Ken Keller spoke with you about some concerns that you had shared with me. Did we get that squared
Yes.
away?
Yes, yeah,
Okay.
he talked to the property owner. And,
Okay.
you know, things got situated there, so thank you.
Okay, yeah,
He
absolutely.
called right up
Okay,
and I think one of the other interesting things is the food and
Okay.
new businesses coming in. It's kind of the economic direction picture that we have through the health department.
okay,
Just some of the health outreach programs you're doing.
okay.
I don't have anything to add.
Okay, so one of the things that we've been thinking about doing, especially since the last 3 years have been so atypical, is doing a public health orientation for new commissioners or commissioners who've come on in maybe the last 5 years who haven't seen us in our normal operations. Would that be something that would be helpful for you?
For me, yeah.
Okay, great. We would open it up to all commissioners, but really emphasize people who are new so that you can have, and we recognize that you have a lot on your plate as commissioners, and so we wanted to give you at least 6 months or so to sort of get your feet on the ground before we held something like this. So we're thinking tentatively maybe July. Where we could bring people in and share information about how we're structured, our budgeting process, and then the different departments and what we do. Okay,
Good.
okay.
And then our health district has 8 counties in it,
Yes,
correct?
correct.
So go ahead and if you'd name off them
Yeah,
counties.
so Bannock is our largest county, and then we have Bear Lake, Bingham, Butte, Caribou, Franklin, Oneida, and Power counties. Yeah, so I did bring just a couple program highlights just to share some information with you, and I wasn't sure how many people would be here, but I think I have enough copies. So just wanted to talk with you about a couple of things that, thanks, Commissioner Moser. Couple things that have happened recently or are ongoing. So we do have an oral health program, and dental caries or cavities and mouth pain is one of the leading causes of school absenteeism in grade school age kids. So that's why this program is really important. We have an ongoing program where we provide dental sealants to kids and also fluoride varnish, which is a substance you can paint on kids' teeth from the time that they erupt into their mouths. It bonds instantly so they can't swallow it. But then once a year, we do a partnership with Idaho State University and area dentists and dental hygienists. It's called Give Kids a Smile. We've done this for 20 plus years. And we target kids in schools that have over 50% free and reduced lunch. We do it in February every year. And we partner with the dental hygiene program at Idaho State University. So this year, we had over 50 dental hygiene students and then 16 licensed dental hygienists from the community, 10 general dentists, 3 pediatric dentists, 2 dental residents, and an orthodontist. The value of the services provided to the kids that day was close to $25,000. And then what we do, many of these kids, because they haven't seen a dentist regularly, have some pretty major issues in their mouths. So the dentists that partner with us agree to see kids in their practices to do more restorative work. And we don't have the total dollar value of that yet because it's ongoing. This year we even had a kiddo who probably needs help from an oral surgeon because they had some additional teeth erupted in their mouth that need to come out. And so not listed on here as volunteers is the oral surgeon who's going to do that work for that child for free. So we feel like this is a really great program. It's helping kids. It's helped getting them connected to dentists. Many of these kids either are on Medicaid or have family health insurance that doesn't cover dental care, which can be cost prohibitive. And so this is a great way to get them into dental care to take care of those issues before they get really, really bad. So any questions about that? Okay, so the next thing on here is we have a program, and I will say that oral health program is largely funded by grants that come through the State Department of Health and Welfare. We also do charge some fees for service in that program. So when we apply dental sealants out in the community or the fluoride varnish, if someone has insurance, we will bill that. Then our next program is our diabetes and heart disease health screenings. So we have Mallory Summers, who is our program lead on this. She's a registered dental hygienist, and she holds community health screenings around our 8 counties. She's done 12 so far in Bannock County, and she has 4 more scheduled before the end of June, which is our end of fiscal year. She's screened 72 people, and she's looking at both diabetes and heart disease risk factors. She's able to do some blood work as well as other basic screenings like blood pressure. And 42% of the people that she's screened in these clinics are considered high risk for development of diabetes or heart disease based on a variety of factors. Maybe they use tobacco, maybe their weight is higher than it should be to be considered healthy. Maybe they have a family history, maybe it's a combination of those things. And of the 72 that have been screened so far in Bannock County this year, 67% of those people had high blood pressure, and of that group, 65% didn't know they had high blood pressure. So she's able to help them identify that, this is something that's potentially placing you at risk for a heart attack or stroke. And so she's able then to refer them to medical providers to get established in a medical home so that they can start managing that condition. In addition, about a third of them were found to be diabetic or pre-diabetic and were not aware of that prior to the screening. And that's really important because diabetes can have its own complications, but it's also a significant risk factor for the development of heart disease. So if people can know they have it and can work on managing it, then they're much less likely to experience costly outcomes if they aren't aware and aren't treating and managing it effectively. In addition, 15% of the people who were screened didn't have access to secure housing, which we also know can be a risk factor for chronic health problems. That program is also funded through grants from the Idaho Department of Health and Welfare. And then the last thing, I just wanted to share some information about septic permit applications in Bannock County. So we've been watching this really closely because just given the state of things with increasing interest rates and the cost of construction and that sort of thing, we have sort of been anticipating that a market that has been really very active over the last, I would say, 4 years would start to decline pretty rapidly, and we really haven't seen that. So I asked them to pull the numbers for the same time periods for this year and last year. So that would be July 1 through March. So of 21 to March of 22, last year we did 72 septic applications, and for the same time period this year we've done 65. So they've gone down a little bit, but not significantly. So just wanted to, and I'm sure you're seeing that too on the county side.
Building permits are going down.
Yeah.
Do you have a general feel for where the majority, if there's a majority of those applications are?
You know, I could find that out for you, Commissioner Huff. I don't know off the top of my head. A lot of them are kind of in the Mink Creek area and then also in Income.
Okay, that's kind of what I was thinking.
Yeah.
I didn't know if my thought process was headed in the right path or
Yeah,
not.
yeah, that's my understanding of things. Ken is actually on vacation this week, a well-earned vacation, because I don't think he's actually taken one in like 3 years.
Yeah.
And so, but when he is back on Monday, I can have him confirm that.
I'll just reach out to Ken. I know Ken, so
Okay.
I'll just reach out and ask
Oh
him.
yeah,
Thank
you guys know each other.
Yep.
Yeah.
And then that's the part that they cover all 8 counties.
Mm-hmm.
I mean, this is just in our county,
Yeah,
and then you get all the other counties that are involved with it too. I mean,
yeah.
there's been a lot of building going on.
Bingham
Like I
has
said.
been just explosive the last couple of years. And I know I looked at their data, and for each of these years, they've had about 30 to 40 more applications in Bingham County than we have here in Bannock County. That's unusual.
Is the EPA doing any changes to the septic standards or anything like that that you're aware of?
Not that I am aware of. Ken would be more in tune, but he's usually pretty good about passing that on to me. So, do you have like a specific question about a change?
No, we've had some issues with some stuff going on down in the Income area.
Okay.
People are very concerned about the wells and the septic systems and things like that. And again, that's not necessarily our area, but as Commissioner Moser pointed out, it rolls up to us because
Right.
people assume that we are in charge of that. And so just looking for some general information to see
Okay.
if the EPA or the DEQ is doing anything with well quality, any of that kind of stuff.
I have not heard that. It doesn't mean it's not happening.
Right.
But that's one of the reasons that we take the approach we do with septic systems is we have to consider proximity to well water, surface water conditions, proximity to any kind of creek or stream, those kinds of things.
Right.
And we're pretty rigorous about that because if we were to allow a septic system in a soil type or too close to a well source, that could
Right.
potentially render that property much less valuable.
Yeah, well, the concern is that we're punching a lot of wells and septic systems into the ground that maybe the existing regulations aren't stringent enough.
Okay.
Just we're having some concern with people on that, and so that was just the general curiosity
Okay.
question.
Well,
Too many straws in the drink.
Yeah.
Yep.
Now, are you all exploring doing some kind of sewer system instead of septic systems?
There
In
was
the Income area?
there was a conversation at one time about a line from Income to Pocatello.
Yes.
We got a lot of flag.
Okay.
When we brought that up, and it hasn't progressed any further.
Okay,
I thought Income was applying for some funds to complete a study to see the,
And they've got that. We gotta spend $40,000 on a grant so that we can get a grant to study to get another grant. I mean, I talked to Mayor there in Income, and they're doing that still.
okay,
But he was also talking about a sewer district, you know.
Okay.
Out of, what's the process? There where their sewer treatment facility is, they're out of ground.
yeah,
I mean,
nowhere to put it.
right now, they're gonna have to hold a lot of this that they've collected over the winter, because the place that they have to spread it out later is all flooded, or
Yeah.
possibility of flooded, covered with snow. So there's concerns,
Okay,
a lot of them.
okay. Would you like me to ask Ken to follow up with you on
you know,
that?
maybe we can have Ken come and just visit with
Yep.
us. But
Yep,
that's part of the discussion,
Yeah.
Commissioner Moser. But if we could have Ken come in here sooner rather than later, that would
Okay.
be great, because I'm doing some looking to see what some other counties are doing with things, and that would be nice just to hear from Ken what's going on, what he's seeing.
okay. Yeah, he is so knowledgeable. I mean, before he was our environmental health director, he was our septic program lead
Right.
for years. And he's really knowledgeable about that kind of thing. So, yeah, we can
Yeah.
absolutely do that.
Great, thank you.
Yeah. So as far as frequency, would like every other month work? Once a quarter?
I think once a quarter would be good.
Okay,
Don't want to repeat, you know, every
Sure.
month, but once a quarter, I think that'd be good.
okay.
And then just another question, we're getting to the end of this legislative session. Anything there that you feel like affects the counties or the health department and what's going on?
So we're written into a couple of things, as far as providing certain types of education to minors. And then Representative Scott did introduce House Bill 316, which interestingly is the same number as the bill that severed the state relationship with the public health districts and placed all that responsibility on the counties. That would allow counties to opt out of a public health district. We were surprised by that. Don Duffy, who is my peer in Public Health District 1, said the conversations he's had with his commissioners, none of them are in support of that at this time. And my understanding is that that's a personal bill, and the only way it will reach the floor for debate is if the speaker chooses to hear it, and we've been told that that won't happen.
We were told it was put in a drawer too.
Yeah,
Yeah, in fact, I was just checking on that this morning, and the answer I got was that it was a information bill, meaning the sponsor wanted to have it printed for discussion purposes, and it won't go anywhere this year. And so my follow-up question was, will there be a follow-up on it next year or not? And so I wanted to ask you about that and see what
Yeah.
your thoughts were.
I think that is unfortunate. I think that this is a structure was created by the legislature in partnership with the counties over 50 years ago, and that has worked really well. I think that there are a lot of services that would go away if a county chose to pull away from a public health district. Over 50% of our funding comes from grants, typically through the Department of Health and Welfare or the Office of the Governor or DEQ. And so if there was that separation, then I'm not sure what would happen with those programs. We employ a lot of people in our counties, and I feel like we provide a good workplace with reasonable wages and good benefits, and that would impact a lot of people. So I definitely would not like to see that move forward. We really try to partner with our counties. We are very cognizant of the reality that you have limited resources. And so, I mean, I think we've asked for 0% increase every year, but maybe 2 in the 12 years that I've been director. So we really try to get the most mileage out of the resources that we have, that we can. We've also created in our obligated funds, sort of county relief fund, and Commissioner Mosier is familiar with this. So we take a sizable percentage of our salary savings every year and dedicate it to county support. So if we were to come to the counties and they were not able to support their contribution, we could pull a portion of that out of that dedicated fund. So, and I think we're the only health district that did that. So I would hate to see that move forward. I think that the ripple effects of that would be really not positive.
Okay, thank you.
Mm-hmm.
And one of them that I was disappointed in, and that's the vaping tax.
Yeah.
Well, I don't know why they won't move forward with that. That's becoming one of the biggest concerns
Yeah.
that we have out there with the youth.
Yes.
Especially
Well, especially when you consider that a lot of vape cartridges now are being adulterated with things like fentanyl. And we're seeing kids and adults overdose as a result of that. We do have a vaping prevention program, and I'd be happy to have our team come in and talk with you about the things that they're doing. They're working with school districts and community groups. So we have a prevention side and a cessation side. And I've been talking with the folks that are connected to the new assessment center about providing vaping cessation services at the center so that it's easy for people to access. And we're very able to do that and would be happy to do that if it would be helpful. So yeah, it's a significant issue.
So when you go into the schools,
Mm-hmm.
we was in Aramel last night, and we hear it a lot that District 25 gets a lot of things, District 21 doesn't. Are we inviting all the smaller
Yes.
school districts
Yes,
to
absolutely.
participate in all these activities?
That's something that we're very sensitive to, and so we have made that offer to every school district in our 8-county area. And whether or not they choose to participate sometimes depends on their resources. So an example is one of the things we've been able to make available is vape detectors for like high school and middle school bathrooms. And we had a really good response to that. So a lot of the schools have jumped on that. In fact, so many that we had to limit the number that we give to each one so that they could all get some. At least for this sub-grant year. But yeah, we absolutely try to work with our smaller school districts as well. Because we recognize they don't have the resources often that the bigger school districts do.
And then we've worked together with the sheriff's office on the Narcan.
Yes.
And how's that going throughout the counties?
So I'm really concerned because there is a bill before the legislature right now that would limit who can administer Narcan to only law enforcement, fire, and EMS. I think that is very short-sighted. It is not hard to administer this. It's saving people's lives. And I don't understand the rationale behind trying to limit that.
Do you know what bill that is, Maggie?
Can I check something real quick?
Yes. Yeah, I don't agree with that
I
one.
don't know if I have the bill
Because
number.
if somebody's walking down the hall and needs a Narcan shot, then you gotta wait. That can be an issue.
Oh, yeah, timeliness is so
Well,
important.
that's why we did the training here, is to train the people. And we appreciate you sending your staff here to help with that, but
Yeah,
right
they,
there, you just push a little button and blast up the nose. I mean,
it's not hard.
I don't know, and it's not life-threatening. I mean, it doesn't matter if you have high blood pressure, it's not gonna
No.
affect you.
Let me look, see if I can find it. Well, my phone is not helping me,
Well, I'll track it
but
down.
yeah, and I can look when I get back to my office too.
Yeah, if you can let me know, that would be great.
Yep.
I'll reach out. See what's going on there.
I'm hoping that it won't pass, and I'm hoping if it does pass, that Governor Little will veto it, because he's been really invested in, with his whole Esto Perpetua task force and trying to remedy the fentanyl and opioid crisis in the state. I don't understand the rationale behind trying to limit that. It doesn't make any sense to me.
Agree.
But as a result of that, the state that has been providing naloxone or Narcan to organizations, including law enforcement, free of charge, they've had a real run on their supply. So normally they would get requests for, maybe like 10 doses or 20 doses. They've been getting requests for like 100 doses or 200 doses because people are concerned that they're not going to have access to it. So I will follow up and forward you
Thank you.
that information.
And then along that lines, the other question I had is, what are you guys doing in regards to the fentanyl problem that we have and trying to combat that? What programs and outreach are you doing?
Yeah, so we have a number of things. So we are offering MOUD services, medication for opioid use disorder, in our clinic. Both of our nurse practitioners are certified to provide that service. And we're trying to hire a counselor that can provide the cognitive behavioral therapy piece of that form of treatment. We have been trying for 6 months now to hire a counselor, and not surprisingly, there's a real shortage of that kind of provider. We've met with Idaho State University's counseling department. They affirmed that the salary that we were offering was competitive, so it's not a salary issue, it's just these people don't exist. And so we're trying to figure out a way to kind of cobble that together so that we can provide that piece of the service too. Then we also have prevention services. So we do a lot of education on available resources. We have an opioid prevention resource guide for each of the counties. It's available on our website, or also hard copy. We do the Narcan naloxone training. We do prevention education in any setting where we're invited. And then I've been involved in Police Chief Shy's sort of fentanyl community task group. Sheriff Manu is involved as well. And we did a town hall meeting in October, but then we've been doing outreach in the community. So Chief Shy has met with the student councils at each of the high schools in the Pocatello area, and I think he's gone to McCammon too, but I can't confirm that 100%. But then in February, Chief Shy, Rex Force from Idaho State University, and I met with the Portneuf Valley Interfaith Fellowship to talk with leaders from the faith communities in our area about the fentanyl and opioid issue. And they were very receptive. And so they would like to now do some education with their individual groups. So that's sort of in process too, just because a lot of people, if you're not dealing with these kinds of things on a daily basis, a lot of people just aren't aware of how widespread this issue is and how serious it is. And so I actually have a meeting this afternoon with Scott Pearhill from the Catholic faith community to set something up that's going to be broader than just the Catholic community. But we'll be moving forward with that to try and get some education and information out as well. So that's primarily what we're doing.
Great, thank you.
Yeah, you're welcome.
Any other questions?
Nope.
But yeah, I think if we meet on a quarterly basis,
Okay.
it'd be great. You go into your budget and we go into our budget
Yep.
and everything else that's going on
Okay.
around us. But thank you very much for coming to visit with us today.
Absolutely.
Thank you, Maggie.
Thanks for your time. I appreciate it.
All right, thank you.
Have a great day.
You too. Looks like we're